Oh no, of course.
Of course.
In emergency medicine and in trauma medicine, anytime you fall from greater than 3 times your own height, you always want to consider worst case scenarios. It doesn't mean that you're ultimately going to have really bad outcomes. It just means that the index of suspicion needs to be high. One small piece. Oh. Shards of glass can also get embedded in the hand or the tissue. We'll get an x-ray of somebody to see if there's actually any pieces of glass still in somebody's tissue. If there is, we got to go find it and try to get it out of there. Sometimes we can't, and you'd actually have to have a continuous x-ray done, trying to navigate the tissue to get it out of there. Whew. What? This movie is disastrous. At least we got some anatomy where we're seeing things we normally wouldn't see. In real life, there's a lot of the red stuff around and it coats things so you can't see it. When we have somebody who comes into the emergency department with bad traumas and a lot of bleeding, you can't see things really well, so we have to get the bleeding to stop. Oh gosh, the crunch noise, probably a distal tib fib fracture. People break this often. It's near the ankle, makes up part of the ankle joint itself. There's multiple bones that make up the ankle joint. Oh gosh. Impaled through the posterior part of their skull or the high up part of the neck going through. The amount of blood coming through could potentially happen. This is basically through somebody's brain stem in the back. The brain stem has to do with your autonomic nervous system and your functions, so it's not compatible with life. Got all the other person's blood in their face, in their mouth, in their eyes, definitely transmitting whatever potential pathogen is in the blood into that individual. You're thinking hepatitis B, hepatitis C, HIV. Those are the big viral ones that you worry about. Oh, glass right into someone's foot. Oh gosh. We get x-rays, we'll see the glass. We want to make sure that there's no broken bone. If it's going through your shoes, you got to cover for different types of bacteria. Depends on if it's a foam shoe versus a normal sneaker versus barefoot. You need different types of medication. And then puncture wounds, you need to close up or have it slightly open to allow drainage. Drainage! It's okay. It's all right. Lawnmower blade to somebody's face. A lot of soft tissue injury. How would somebody pass away from this injury? It would have to go deep enough to cause the destruction of the brain tissue and interfere with the airway itself. Oh my gosh. Just rip it out. Just rip it out. You're screwed. Just rip it out. Well, now you're on fire. When somebody does come to the ER with burns, we want to make sure heart rate and blood pressure are all normal. We also want to make sure that their airway is intact. If there's concern that the airway might get occluded soon because of swelling or melting of the airway, we'll do an early intubation to make sure that we're protecting them. Oh. Yep. Nope. I mean, what? How much body surface area did you get burned? What areas of the body did you get burned? And lack of oxygen, smoke inhalation, altered mental status from the chemicals that are being burned, or you've burned your airway so badly that it's melted away and you can't get any oxygen in.
No one gives a shit about your stupid little death curse, okay? So take a hint and leave us alone.
Oh gosh.
We're not coming for our family.
Oh my gosh. Oh, it's a compactor. Oh my gosh. That is so scary. What? What? Oh my gosh. Slow compressive force crushing the jaw, skull, and the rest of the body. Most of the time, jaw fractures we end up seeing from somebody getting punched in the face. Fracture might happen over here, and then you see another one on the other side or in the middle because the energy has to come out. They did a good job of like skull fractures open. You're gonna have bleeding because of the tissue ripping open.
telling me you're not allergic anymore?
I don't know, man.
That's just perfect, isn't it?
Maybe I grew out of it.
When somebody has an allergic reaction, the first thing we always think about is the hives that we're getting. What also will happen is you'll have swelling of tissue where you feel like your throat is closing because you're having swelling of the tissue of the tongue. And then your blood vessels are vasodilating, so your blood is going out to the periphery, your blood pressure is dropping.
Hey, you're doing it. Yeah, you're doing it. Bobby, you're doing it. I can't give you that.
Emergent treatment is epinephrine, adrenaline, that EpiPen. You just slam it into your tissue somewhere, get it in your body. Sometimes you have to have multiple doses of it. It's really good to make sure that you have a 2-pack of your EpiPen with refills.
Bobby, hey.
Wait, what? Watching these treacherous injuries reminds me that sometimes life's occasional stresses can hit just as fast. That's where Chillax by my company Life Happens could help ease the tension and bring on those calm vibes. Check it out at lifehappens.com or Amazon. What the heck? Oh! Oof. Oh my gosh. Come on. I think this is called the Prince Albert. I think. Bent backwards like that. Is there enough force to be able to do that? I don't know.
I don't know.
Wow. He's got a lot of facial swelling. We do see that people's faces will swell, but he got the epinephrine in there, so hopefully it starts kicking in pretty fast. It usually works pretty fast. You'll start feeling tachycardic, a little jittery, but that is normal. Keep moving, keep moving. These things weigh a lot. If they hit somebody, they're going to crush you. These cases don't come to the emergency department because they're DOA, basically. They're pronounced on scene. I believe in an earlier Final Destination, there was an issue with big trees on the highway. Oh, nice hair. I did this once when I was in college, my freshman year of college. I dyed my hair the same color. Oh, it's got a tracker. The skin behind the ear here. There's not much tissue underneath. You have the skin, and that bone back there is actually your mastoid. Sometimes that can actually get infected, the bone, if you have really bad ear infection, and then you can get something called mastoiditis, which is actually quite dangerous. Oh, geez. Oh, come on. Come on. Oh, that's gotta hurt. Brand new razor blades are actually really sharp. We actually use tools in the emergency departments or in the hospital that are similar, like an 11 blade, but it's not sterile, right? So just be aware of that. Oh. I'm assuming this is quite painful. If I were to do this, you need to anesthetize the area, inject some lidocaine to it, numb it up so you can make it a lot easier. Other ways you can do, maybe can use some ice to numb the area, but the numbing is gonna go away pretty fast.
여러분들이 하실 게임은 가위, 바위보,
Paper, rock, scissors, -1.
아시죠?
Oh.
두 손으로 가위바위보를 하고 하나만 빼서 남은 걸로 승부를 겨루는 게임.
We see a lot of trauma to the face, bleeding, bruising, different colors, and that does happen depending on the timing. Bruising starts out as more like red, then turns to like blue, purple, and then actually over time will turn to like a greenish yellow and then disappear. It just has to do with the breakdown products of the red blood cells.
이 권총에 총알 하나를 넣고 닫습니다. 그리고 지는 분 머리에다가 방아쇠를 당길 겁니다.
Gunshot wound to the right side of the head, going straight across. You have the two hemispheres. If you hit it perfectly down the middle, there is a chance that you're not going to have as much damage, minus the fractured bone particles from the front and the back. He sacrificed for his buddy. Oh, you're definitely hitting tissue on both sides, and then a lot of your major structures are actually deep within the middle section of our brains. We don't see that many gunshot wounds that come into the emergency department where it's directly to the side like that. Usually they're very angulated. If you're close up like that, you're gonna have gun residue, you're gonna have burns to the scalp. It's not gonna be as clean as it's depicted here in the show. But yes, the likelihood of survival is pretty minimal unless it was a blank.
지금부터 제가 하는 말 잘 들으세요. 이거 그냥 게임이 아닙니다. 게임을 하다
Oh no, remember in the first season, this is where you play red light, green light, 1, 2, 3. Oh.
뭐야?
Oh no! Anybody out there allergic to bees? Let me know in the comments. But I wonder if somebody were to be bitten and it went into like anaphylaxis or something, if they had medical care to help them during the game. I don't know. Do not move. Oh no.
다 움직였어.
Oh! Took a shot and direct hit to the head. That other guy got blood all over his face, definitely into his eyes, even into the mouth. Increased the risk of getting transferred of any bloodborne pathogens. The bloodborne pathogens that I'm talking about is like HIV, hepatitis B, hepatitis C. Those are the big ones. Oh, took a GSW to the upper part of the chest on the left side. Could hit the heart, could hit the aorta, which is like this big, massive blood vessel coming off our heart that literally supplies all the blood to the rest of our bodies. If you get a big hole through that, you're gonna bleed out really fast.
그거 하면 안 돼요. 저도.
장례가 정리될 때까지 잠시 기다려 주시기 바랍니다.
너 이게 뭔지 알아?
엑스터시.
Oh, that guy is using some illegal substances. Ecstasy is MDMA. It's a stimulant and a minor psychedelic, so people use it at like raves. Ketamine is a dissociative hypnotic, and we actually use that medication at the hospital for sedation.
이거 새로 합성한 거라 완전 crazy man. 너 감당 안 돼.
I wouldn't pop any of those suspicious pills, but if I was needing a little more chill in my life, I'd reach out for Chillax by my company, Life Happens. It's an occasional stress support supplement. If you want to learn more about Chillax, check it out at lifehappens.com or on Amazon. Okay. Oh, 10. Go. Go, 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 go. It almost feels like sometimes in the emergency department, a little bit of chaos happens often enough that people are able to control their emotions and get the job done. Oh. Get out. It looks like it's a different number, maybe number 2. That position can collapse the trachea, decreasing oxygen. You can collapse most of the airway down because the cartilage of the trachea is kind of flexible and it doesn't go all the way around, except for one, your cricoid cartilage. You also have to think about the blood flow in and out of the brain. Oh. I don't see these type of injuries that come in. Somebody who has a high cervical injury where the autonomic nervous system is not active, so you're not breathing anymore and your heart stops. Does it happen that fast? Hard to exactly know, but probably pretty quickly. Oh! I can say I've never been punched in the face before. I've taken a soccer ball to the face, but getting punched in the face hurts. You're hitting your bone, but also hurts somebody else's hand. And we get very common fractures of people's hands called the boxer fracture. Oh, the bleeding in the mouth is the worst. Most likely 2 different reasons. Your mucosa on the inside hits your teeth and causes a laceration, or your teeth start getting loose and you start bleeding from the gums. Oh, he's trying to choke out. So it looks like most of the pressure is on the trachea. And actually you can see the lips are starting to turn blue here. Actually really good depiction of it.
He's turning blue.
You're probably going to lose your airway soon, or you can actually cause a break of the cartilage. It bends a lot, but you can cause a break there. Or if it's high enough, there's a hyoid bone. You can fracture that as well. What happened? That was like a gooey, squishy noise. Oh man, a submental puncture wound with a fork underneath your mandible here. A lot of soft tissue here going straight up into the floor of the mouth. It's gonna cause some bleeding and pain, but it's not mortal. It's not gonna make you lose a lot of blood.
Should have gone for the head.
You're addicted to television, and you're not exactly Mr. Cold Turkey either. Remember that time you tried to give up candy?
I'll ask you one more time. Are you sure you didn't eat anything in my factory?
No.
A few moments later.
People can get addicted to anything. Fitness, exercise, the stuff that we worry about, alcohol, or even different foods.
Just asking.
What are you calling me a liar?
No, I'm just saying.
Hey, shut up!
Violet, you're turning violet, Violet.
Violet, you're turning violet, Violet.
More often than not, if somebody starts swelling up after eating something, that's an allergic reaction, treated with an EpiPen, especially in that situation. There's other medications that we use, such as an H1 blocker, an H2 blocker, and a steroid.
Watch Stewie for a minute.
Sure.
And please keep a close eye on him. Remember what happened last time.
Stewie, get down before you hurt yourself.
Shut up! You're not my mother!
Good God, are you all right?
So very interesting, the skull itself isn't permanently shaped until we're older, like later teens, early 20s. Because of the suture lines, they're not totally fused until later. I don't know if anybody's seen, but they're like kids that wear those little Tron helmets. They're shaping helmets to allow the skull to reform into the more rounder shape.
The principal cut sex ed class to save money.
What? Well, that's crazy. Without sex ed, kids can wind up sexually confused.
Sexual education is definitely really important at the home or in school. It's really important to know the potential consequences of sexual relations, especially if you're young, so you understand what could happen, aka a baby or permanent viral illnesses.
Just look at Michael Jackson.
The kid in me likes the frosted side, but the grown-up in me likes the kid in me.
Okay.
I got a job following fat people around with a tuba.
That's so messed up.
I have a glandular problem.
He says he has a glandular problem. Majority of the time when people are discussing that, they're talking about their thyroid and being hypothyroid. Not having the normal amount of circulating thyroid hormone can cause weight gain and make it very difficult to lose weight.
You will die in a plane crash and be reincarnated as a prophylactic.
It comes back as a condom. A prophylactic in general is something to prevent a disease, an injury, or a problem from occurring. There are different prophylactic medications. You might have a prophylactic surgery, vaccines.
All right. No, not all right.
It was good in this scenario that they were using protection because it helped prevent the spread of sexually transmitted diseases.
If you're that hungry, go down to the dock and find Daddy, and we'll get dinner started.
You're not gonna get dinner started. She's gonna tell that sloppy old Spanish maid to do it. And she will, but only because she needs money to pay for medicine for her prematurely overweight son, Diabeto.
You can be born as a type 1 diabetic where you don't produce insulin and you need to have insulin versus somebody who is a type 2 diabetic where they basically over time actually burn out the cells that produce the insulin.
Mama, may I have cookie?
No, Diabito. Roll back to kitchen.
Oh.
Oh my gosh, oh my gosh. A lot of stereotypes there, but you have to be careful giving too many sweets to the younger population because then we're setting them up for early diabetes.
God, we've got to get him to a hospital. Don't worry, Brian, I'll save you.
Clearly, Brian's had way too much and needs a trip to the hospital. If you want to support your liver and hydration, you should definitely check out Poor Decisions by my company Life Happens to help you metabolize alcohol better, hydrate, and bounce back quicker. Check it out at lifehappens.com or on Amazon.
I'm good in a crisis. After all, I used to work the suicide hotline.
I just can't take it. I discovered my wife's been cheating on me for a while. I have to kill myself.
Doesn't it make more sense to kill her?
Oh, that is a thought some people would have in their head, but not the appropriate thought. We do have hotlines for people who are feeling anxious, depressed, or suicidal, or even homicidal, and have a conversation with somebody who's trained versus Peter.
We can't have a bat flying around the house. We gotta do something.
If there's a bat in the house, if you don't know how long it's been there, sometimes there's a concern about rabies. Bats can carry rabies, and you don't necessarily know if a bat has bitten you because their teeth are potentially really, really sharp.
Don't worry, Lois, I'll get rid of it. It'll be a piece of cake, just like my penis enhancement. I want it to hang down to my knees. They moved up my knees.
Trying to make your genitals larger, very hard to do. There are situations where you can actually have a penile transplant if there's a micro penis or other issues relating to it.
Be more careful next time.
I know, what a stupid injury, huh? I haven't been this embarrassed since I was a rookie firefighter.
Oh gosh, what happens?
Sorry, first day, still learning.
Peter has bandages to his head. In a lot of shows and movies, you see people with full bandages like that to their head. We don't typically put these on individuals long term. You gotta suture something up, glue it closed, or staple it shut on the scalp.
He suffered severe head trauma. So if you want to beat him in Mario Kart, this is your chance.
And the champ is dethroned.
He has some sort of traumatic brain injury. He might have a little bit of bruising to the brain. It might make him a little bit concussed or a little bit still out of it. Sometimes people can have head injuries where they have transient global amnesia. It's temporary, where they don't remember things.
Where am I? Until the Board of Health gives the okay, you're done.
Wow. I actually got the place shut down.
Toxoplasmosis is an infection caused by a parasite with a very similar name, having picketing in front of a window with cats, because cats can spread or transmit this parasite.
We've hardly done anything together since we made that fiber commercial and had to use code words for pooping. Just 2 spoonfuls a day to stay regular and active.
More coffee, Stewie?
Yes, please. Oh dear, that was a mistake.
Make sure if you're using fiber that you drink a lot of fluids and you have good bowel movements and get moving, meaning getting up, walking. At the hospital, if somebody is post-surgical, they've had surgery, we get them up moving so we get the bowels moving so they can get all that stool out of their body.
Wait, you mean you're about to be active? Currently active. Cut to the shot of them stirring the product into water.
Gurglemax. Take a massive comfort.
Oh God! Oh, there's regular on the carpet!
We have to provide this type of medication for individuals that are going to have a colonoscopy. That can cause cramping, and the cramping is related to the intestines peristalsing, as well as having some fluid dynamic changes within them as well to get all the liquid out.
I'm sick of being one-upped by Doug. Hurts. Hurts worse than a trip to the barber shop. Ah! Ah!
The barber, it's got the red and the white stripes. They used to do bloodletting back in the day. That's what part of their skill was. We see bleeding like this when a varicose vein is like ruptured open. It's a really intense pressurized stream, and it's just because of the back pressure.
Mom, my lips are too thin. Can I please get collagen injections?
Collagen used to be the more common injectable into the lips. They're different materials. It's hyaluronic acid. There's brands like Juvederm or Restylane. Those two end up lasting maybe 6 to 12 months versus the collagen injection, maybe 3 months, 6 months.
Meg, you don't need to change the way you look. You know, most of the world's problems stem from poor self-image.
It happens all the time in healthcare, in medicine. Somebody has a potential poor self-image and they may use substances, eat poorly, and a lot of these other issues stem from that, meaning poor control of chronic medical conditions because your self-image makes you not want to do things. It's messed up. Working out, lifting weights, it definitely is good for you. It releases your endorphins. So if you are feeling down or having a poor self-image and you need a boost or you want a boost, try working out, getting outside, or exercising. It actually could have significant and profound effect on your body, making you feel a lot better.
Don't take no for an answer, Chris. You're a griffin, and a griffin never knows when to stop. Clear.
Oh, interesting. You do not do defibrillation in the setting of somebody having a flatline. You do it only when you have VTAC or VFib. We don't have those paddles like that anymore in the emergency department. We have pads that stick on so nobody's actually holding. They stay in place.
Clear.
Oh, you saved my life, Doctor.
Clear.
Very rarely does anybody wake right up after a defibrillation because they're not really perfusing the brain very well. Even though you're trying to do that with CPR, it takes a little bit of time.
Far more assists than goals for one of the terrific finishers in the NHL.
Oh, he took it to the head. Oh, slap shot. I know he's wearing a helmet, but I think it hit him in the ear versus the side of the head. You got to worry about concussion, right? Skull fracture. You got to worry about an epidural hematoma. Get hit with that amount of trauma to your head, you got to get a CT scan.
Oh, man.
That hit little, up high.
Oh, man. You have your middle meningeal artery that sits on the side here. If you get hit on the head, increased risk of rupturing open. And on the inside, you can get a lens type bleeding. You wake up, you're doing fine, and then you go to sleep, and then bad things happen.
Motioning to the training staff to hurry. He skated off with some assistance.
Took it to what they think is to the ear, causing a tympanic membrane rupture, aka eardrum rupture, because of the compressive force right into the ear canal. Hurts like heck, will cause bleeding. Most of the time, the eardrum will heal on its own.
Wide. Oh no, the skate came up on Boychuk.
Oh.
As Lekkonen was headed down to the ice.
Oh, shnikes.
He's cut. He's heading right off the ice.
What? Laceration to the face, straight up. Required over 90 stitches. The eyelid, super important. You have tarsal plates, it has to be perfect, because if it doesn't, you can have continued corneal abrasions or abrasions to the eye.
They're up the wall.
Oh, we got the Bruins.
To Savard. Savard looks for Ryder.
Oh, that's an excess hit.
Tips the puck away. Savard is reaching for his helmet.
That is a mean hit, just squishing someone's head. We get really concerned when people hit their head, either if they pass out, they're altered, they have neurologic symptoms, they're vomiting, the visual changes, all of these things super concerning.
There was a collision down in the corner behind the play, and I don't know if Savard's opened up, but he is in a lot of pain. Don Del Negro has pressure on Savard's head.
In an adult traumatic head injury, we'll probably get a CT scan. If you're under a certain age and you're a pediatric patient, we do worry about scanning somebody's brain, so we don't always want to just jump to a CT scan.
As Carl Alsner puts the puck down into the Carolina zone, Pitkin just does get there in time. It's icing in there.
Massive, like, smack into the boards. This guy ended up fracturing his calcaneus, the heel bone. Most of the time, the calcaneal fractures that we see are due to people landing directly on their heels. Here, you're hitting it from a different side or an angle. It could be compressive force.
Being helped by members of the training staff and the physician staff.
Healing from these actually take a really, really long time. When we want to put a splint on this, we can't just put splint material and then wrap it with an ace wrap. You need to pad it. Typically, you're going to get bad bone blisters on the skin due to the fact that you're having so much swelling.
Trent McCleary took a punt to the throat, fracturing his larynx.
Talk about sacrifice. Fracturing the larynx. You actually only have one bone in your throat, the hyoid bone, which sits up a little bit higher up here, versus the larynx and this area, your trachea, basically. This is all cartilage here. You can break the cartilage. Yes, you can do that.
And also suffered a collapsed lung. He recovered, but ultimately had to retire.
The fact that this shot actually caused a collapsed lung is quite interesting. It must have rattled around in here enough and caused enough force to pop the lung. The other word that we use in the medical world is called the pneumothorax.
The granddaddy of them all, Clint Malarchuk.
Oh, look at that! Oh, damn.
And a boatload of blood. And it wouldn't be the last time we saw an injury like this.
Wow. Blade right to the neck and a bunch of the red stuff. Both the carotid artery and jugular vein get lacerated, and you can see different flows of blood. Some are dripping and then some are a little bit more. And it's because of the different vessels sitting right next to each other.
Played up ahead, it didn't connect with the rookie.
Oh, gloves are thrown.
And we have the possibility.
I don't understand the logic of having fights with your bare hands. But this is hockey. You always see people get fights.
Battle right here. Delorier and Rempe.
Look at this, like sizing them up.
This started in warm-up.
Okay, grab, punch, grab, punch, grab, punch.
Sold in the mind.
I do not recommend fighting. Oh my goodness.
And the crowd is
okay, all right. We got abrasions to the left forehead and a small cut to the nose.
Your nose!
That area of the nose, sometimes if it's a little bit more midline, there's a vessel right there and it can bleed a ton. Sometimes we literally have to put one stitch in there just to get it to stop bleeding.
Smith drives to the net, goes around the net, pass block. Here comes McDonough with Zuccarello. Zibanejad is hurt behind the Rangers net. He is really hurt.
Distal tib fib fracture. Down below at that area, you have a specific retinaculum where the bones are actually connected to each other by a really cool type tendon. It's a really good support structure until it actually fractures through.
Smith had a little bit of room on the left wing, and as he tried to cut in towards the net, Zibanejad didn't want to let him get to the net.
Watching these incredible hockey players reminds me you need the energy and focus to stay in the game. That's where Level Up from my company Life Happen comes into play for powering through any activity, whether you're chasing a puck or chasing your next workout. Check out Level Up at lifehappens.com or on Amazon.
Here it comes again. That was Zibanejad.
Oh, he got caught. Always.
You just see him lose his balance on the collision.
Oh, that was not supposed to snap that way. He does have a fracture to that left lower extremity. You can see how it bends in a way that it shouldn't. You'll definitely need to get the fibula probably repaired with some plates and screws. And then the question ends up being, does the orthopedic surgeon do plates and screws versus a medullary rod straight through? It just depends how distal it is. So if it's more mid-shaft, you'll probably have a rod through it.
He comes in, he hits Zubers. It is the skate that comes up right there.
Oh, went underneath. So hit him in the Flyers player. Oh, look at this. The laceration to the abdomen. Did they already put glue on it? That hurts. You're going to have to bandage that up. Make sure it doesn't bleed. He got lucky. He didn't go through far enough into like the abdominal muscles and into the abdominal cavity.
He goes to the bench, and they're just taking a look at him on the bench. Doesn't look like he needs stitches. They're just stopping the bleeding, put some salve on it, make sure he doesn't get any infection. And he's right back on the bench.
The commentators are wrong.
You're wrong.
That type of device that they have, it is either Dermabond or it is benzocaine, which could be used to put on steri strips to make the skin a little bit stickier. I do have to say that I'm not the biggest fan of the Flyers, so hopefully they lost the game, but hopefully he's fine as a person.
And there's this block shot by Gregory Campbell. And he was out on that ice for a good 45 seconds after. He blocked that shot.
Got a broken leg is what I'm told. Puck hit him on the lateral aspect of the leg. I anticipate it's a fractured fibula.
While shorthanded, we saw the same exact thing happen last night in Los Angeles with Nicholas Jalmerson, Blackhawk defenseman.
How is he skating? The fibula is the bone that runs along the outside of your leg, and it's the non-weight bearing bone. So you can step on the leg, it just hurts like hell.
42-year-old male Sam Wallace, blunt head with agonal respirations. Dropped down on the T-tracks. Couldn't tube him, LMA in place. Suicide attempt? Rescue.
Oh, very interesting. Agonal breathing, so his respirations are not adequate. And then they put an LMA, so a laryngeal mask airway, so it's a supraglottic. So if you need a quick airway, you could put this device in.
Woman fall from T platforms, good vitals, no head injuries. Degloving injury, right lower leg with open fracture dislocation of the
Oh, ouch. Degloving injury meaning that the skin and some of the subcutaneous tissue have been removed like a glove, meaning like turned inside out and peeled off.
Good breath sounds bilaterally, but we need to protect his...
Apparently, he jumped down to save the lady. When he climbed back up, he slipped, fell back and hit his head.
It's more of an R2 Mel, right? I need you on the E fast.
They're working him up as a trauma. Likely that there's going to be a trauma surgeon coming down. The emergency team gets it started. So doing an E-fast, you're basically looking at quick to see if there's any pneumothorax, as well as the fast exam is the focus assessment, sonographic exam, and trauma, basically.
Pupils 4 millimeters and reactive.
Okay, that's encouraging.
So describing the pupils, the size, and that they're reactive. So that is encouraging when somebody has a head injury, especially when they're agonal, because if they're not reactive or they're sluggish or that they're different sizes, that's concerning for intracranial abnormality.
What do you want for meds? 120 ketamine, 80 of rock. AFib on a monitor.
120 milligrams of ketamine and 80 of rock. What do these mean? These are medications that you would do for a rapid sequence intubation because they're going to take out the LMA and they need to put an ET tube in.
Students, what might have made her faint on the platform?
Could be an arrhythmia, cardiac event. So she needs
EKG and a troponin. Okay, good.
Got pretty people.
So you hear 2 grams cefazolin, so that's an antibiotic, so they're giving it early in the setting of a bad open wound like that. But I do like to see that everybody's in their PPE. They got eyewear, they got gowns and gloves on.
Med student down.
I don't mean to laugh. So once you put it back into place, you need to splint it so it doesn't move again and get an x-ray to make sure that it is where you want it to be. If not, you need to do it again, or the person needs to go to the operating room sooner than later. People do pass out in medicine. The majority of the time, it's due to the fact that you're either holding your breath, your vagus nerve gets involved because you're seeing the issue as like a total person problem, blood, versus looking at it as a problem that you need to fix.
Temp 98.2. Take a deep breath for me, Otis. Little pinprick now, okay?
Oh, passed out. Check a pulse, make sure you're breathing, but you'd be like, oh gosh, put on a cardiac monitor, get staff to help you, that sort of thing.
No pulse. Crash cart laying flat.
That's scary. The crash cart, you hear it all the time, has a defibrillator on it, has medications that you would need for cardiac arrest, has all the emergency stuff. But you need to lay this person down quickly, get CPR started, put an AED on, get rescue breaths going.
How you doing there, Otis?
Okay.
What happened?
VTech again? 200 joules.
Charge.
So that was quite accurate. You know, you charge it to 200 joules. Typically, you would then continue to do CPR for 2 minutes and then check the rhythm. You can be in an abnormal rhythm with a pulse and just do this type of cardioversion versus defibrillation when the patient is pulseless and you're trying to prevent their death.
And clear.
Back in sinus. What are you doing?
1 gram calcium glutamate, IV push.
We don't have the labs back.
Look at the monitor. Wide QRS and peak T waves, hyperkalemia.
All medical jargon, basically meaning everything is back to normal, describing the event and that his vital signs, blood pressure and pulse are good.
Intense exercise caused muscle breakdown, rhabdomyolysis, knocked out his kidneys. Now he's not clearing potassium. I bet it's over 7.5.
Wait 2 minutes for the ice.
If you arrest him, we might not get him back.
Calcini, you could kill him. Wait.
It's my long story. Dr. Collins will fill you in.
I mean, he's an actor doctor, but that's pretty accurate. So we're talking about elevated potassium levels, probably due to muscle breakdown, rhabdomyolysis, and renal abnormalities because of all the training that he's done.
We gave you medicine to lower your potassium, and you'll need dialysis to clear it all out.
Then I'll be okay.
Yeah. You might need a week or 2 for your kidneys to recover, but yeah.
There you go. So he had hyperkalemia, high potassium, and they say that he needs dialysis. You don't necessarily need to jump to dialysis if they have normal working kidneys, but if the kidneys by lab work are shut down so badly, you might need to do dialysis.
Gonna miss the morning arrival of the living dead.
How many are we expecting?
We're getting 3, but 1 died en route. I don't know who's luckier, us or them.
What's open?
What they're describing is kind of common that happens. In the morning when they do rounds at nursing homes, they find individuals that don't have pulses. And so a lot of 911 is called early in the morning.
89-year-old woman from a SNF. History of emphysema, CHF, MS. VFib, unresponsive to 3 shocks, 2 rounds of epi.
VFib, unresponsive to shocks and epi, so standard protocol. And so this individual is on the Lucas machine, which is basically the machine that's doing CPR for you and appropriately put on. All very good. Typically when you're bringing in a cardiac arrest into the hospital though, you are moving a little faster.
Everybody get a hold. 1, 2, 3.
Oops.
Students are dropping like flies.
Take a break, ice the finger.
I mean, it does happen. Any job, somebody could injure themselves, but in medicine, it's like, okay, if you're not able to help, just don't get in the way. People injure themselves a lot at the hospital, lifting a lot of people, moving them around, and your first concern is always for the patient. You forget your own body mechanics, and sometimes you can injure yourself. So
you can count on getting a couple elderly patients every day around 7:30 after the nursing homes and assisted living facilities do their morning bed checks. You can practically set your watch.
Was there an advance directive?
No, full code for the nursing home.
Seriously.
Lucas off.
it's appropriate to ask that, and do they have an advance directive? In California, we call it a pulse. Do you want CPR? Do you want to be intubated? Do you want to be put on a machine? Or do you want comfort measures only? But it's really important to have advance directives, especially in your nursing facility. And the reason why they're frustrated is this person has long-term major chronic medical conditions that are not really recoverable. They're manageable, but not very recoverable.
Still VFib.
Lucas on. One more round of epi, one more shock, and then we call it.
Okay, let's move her to the viewing room and notify the family. Yeah. One of the things we do here
is to take a moment of silence when we lose a patient.
Pretty accurate. Sometimes patients will come into the emergency department. You'll do a couple rounds of CPRs and call it. They don't do it in the field. It's because there may be another intervention that they may not be able to see that we could see or do at the hospital. But ultimately, if patients have a long downtime, given the appropriate care, it's time to unfortunately stop.
Hi, I'm Dr. McKay. What's going on?
I found her on the floor in the bathroom. She can't stop puking.
What's her name?
Teresa, she's my mom.
Scenario that's not that unique, where even myself goes into the lobby of the waiting room. You're getting stared at by all the patients. They need our attention. The emergency department is not a first come, first serve. It is a treat and deal with the most life-threatening, limb-threatening problems first, and then prioritize length of stay.
I would never go anywhere. Is she gonna have to stay here?
Oh yeah, I need a fresh set of eyes.
On what?
54-year-old woman brought in with intractable vomiting by her 18-year-old son. I'm getting a weird vibe.
Hi, Dr. Robbie. We need to do a pelvic exam.
So that's pretty good. So the doctor has a weird vibe, so gestalt or feeling, and that is huge. And you have to be aware of that and use it to your advantage. You have to kind of get a sense that, okay, something's not right, so we got to investigate a little bit further. You don't want to be accusatory, but you also need to be direct.
The army ant is placed on the wound and positioned so its jaws clamp tightly on the edges, securing them together.
What would we normally do with a suture, right, or a stitch? You literally take your needle that has a curve, typically nylon as the material. You make an arc, you go underneath, and you tie it, and it becomes like a big circle like this to approximate the wound edges.
The ant's body is twisted off, leaving its head and mandibles in place, which acts as a stitch. More are added depending on the size of the wound.
You still need to prep the tissue to make sure you don't get infection. Same when somebody comes to the hospital, we gotta clean the skin around it before I make those sutures because there's bacteria on the skin.
These ant stitches are left in the skin until the edges of the wound stay closed on their own.
This is actually used in areas around the world where you don't have access to potentially a suture and you need something to close your wound. Handling them and controlling them, I think, takes a little bit of time and practice. Any of you out there ever done this before? It's actually pretty crazy and cool and sad for the ant, but you heal.
If your ear gets ripped off, you can actually take some cartilage from your rib cage.
Yeah.
Then a doctor will carve it into the shape of an ear and place it into a pocket of skin on your forearm.
Our ribs attach to our sternum by cartilage. Sometimes people end up getting costochondritis, which is inflammation of that cartilage, which causes sharp chest pain, just so you know that there is cartilage in that area and it does get inflamed, and we can use it for other means.
Inside your arm, it develops and forms new blood vessels and skin. Once it is fully developed, the new ear is removed from your arm.
Your ear is all cartilage with some blood vessels and skin around it and a little bit of subcutaneous tissue. Can you put it in a pocket somewhere? Anywhere? Yes. Forearm, hip, belly, anywhere.
The new blood vessels are attached to your ear hole, and the skin is carefully stitched to your head, giving you a new ear.
Can you then put it back on? The issue will end up being the nerve growth. So you have neovascularization, so new blood vessel growth, but nerves take a lot longer. And is that ear innervated, or do you have like nerve function to that area? It could take a long time to get that to come back. If it does,
a doctor could theoretically sever all of the blood vessels in your neck and connect them to the neck of a donor body. Then the muscles, tendons, and bones are precisely cut and your head would be fully disconnected.
Yes, but nerve function probably, most definitely at this current time, would not be functioning appropriately.
The surgeon would then spend hours reconnecting everything in your neck to the donor body. And once everything is attached, in theory, your head would be completely joined to a new body.
Could you take those blood vessels methodically and attach them? Yes, you could. And muscles, bone, ligaments, tendons, all that stuff could be reattached. The minute you sever that spinal cord, then there's no more function. So there hasn't actually been a successful head transplant in medicine.
If someone has bone cancer in their femur, a surgeon will sometimes amputate the affected area, removing the entire middle part of the leg. But they leave the major vein, artery, and nerve intact.
How amazing is that? But it's true. Bone cancer in this specific area you don't see so often, where it's just isolated, where they just need to have this amputation. But people do get bone cancers, and if you can fix it in such a way that gives them a meaningful rest of their life because you're able to save the joint, it's amazing.
Then they bring the lower part of the leg up and rotate it 180 degrees. By turning backwards, the ankle joint essentially becomes...
How cool is this?
This is because it can mimic the knee's bending motion.
I've done amputations when I was a resident. You're leaving a stump, and that could be painful, uncomfortable, putting a lot of pressure on an area, versus here, your joint's going to change and have to adjust, but our brains are amazing. They can figure that out.
And while it might look bizarre, it's actually very helpful for amputees. The backwards ankle fits perfectly into a prosthetic and gives more stability and mobility.
You keep the ankle, but you keep the foot. There's no need to get rid of the foot. It actually gives it more of an area of structure and support.
In 1848, a large iron rod drove through the face and head of a man while he was working on a railroad.
This is why I say never pull anything out, because you need a surgeon there to just to double check structures it's going through.
It passed behind his left eye and exited through the top of his skull, and he somehow managed to stay conscious while the rod was removed.
Went through the face, so you're bleeding, fractures. The left eye probably wasn't functioning anymore because behind the eye you have your nerves, your muscles, so if that connectivity got messed up, the likelihood that you'd be able to fix it is pretty darn low.
Now, he did survive this incident, but he wasn't really the same person. You see, the rod went through his frontal lobe, and this area of the brain is responsible for decision-making and self-control.
Very good example of frontal lobe injuries. It's very similar to what we've seen when people get shot, you get a stroke in the same area, personality change, decision-making. You see a lot of this too, and somebody might even have Alzheimer's, where the Alzheimer's is affecting frontal lobe. Sometimes we'll even see this when somebody has a brain tumor that nobody knows yet.
If you were swallowed by a sperm whale, you would be squeezed down its massive throat. You'd continue down the esophagus and into a series of stomach chambers that are filled with digestive acids.
Stomach acids are designed to break down what you ingest, and they're highly corrosive. The stomach lining has to rebuild itself because of the acid environment.
And these acids would immediately start breaking down your body. But even if you manage to avoid the acid, the lack of air inside the whale would quickly cause you to suffocate.
Now you're inside a closed chamber that oxygen is not getting into. So you're breathing out some oxygen, but you're mostly breathing out CO2, right? Most of the time you're going to suffocate, but you're actually going to get lightheaded, dizzy, and slowly fade away.
If a kernel of corn somehow got up your nose, some people think that it could potentially sprout, meaning you'd literally be growing an ear of corn in your nose.
We do pull a lot of foreign bodies out of people's nostrils. Typically, many different tricks to get it out. If something is stuck and it's further back, you can just blow it further into the back of the throat. Just don't inhale it.
Now, this is obviously crazy, but a 4-year-old once inhaled a bean, which then got stuck inside his nose. And because the nasal cavity is warm and moist, it allegedly created a suitable environment for it to germinate.
Another way is if it is your own kid and say it's more in the front of the nose, you can blow air into your child's mouth, hold the one nostril that there's no foreign body in, and it should come shooting out.
After several days, the seed actually sprouted and began to grow until it was removed by doctors.
That one was easy because the sprout came out, so you just grab onto it and gently pull. There's another thing that we use. There's a device that's almost like a very thin stick that has a little balloon on the end, but the balloon is collapsible. So you put it past it, blow the balloon up, and just pull it forward.
If you stopped blinking for 30 seconds, the moisture on your eyeball would start evaporating. And over the span of a few minutes, the first layer would dry out since it relies on the eyelids to cover it with moisture.
When somebody somebody's having procedures done at their eye where their eyes are open like this, the doctor is going to be using ointments and drops to keep your eye moisturized. In the emergency department, the most common area that I see this happen is when somebody has Bell's palsy. Bell's palsy does not allow you to totally close your eyelid and blink, so it dries out your eye.
After about 10 minutes, your vision would become blurred as the tear film breaks down. And a few hours later, all moisture would be gone, causing damage to the cornea, which would significantly impair your vision.
If thought-provoking scenarios like this keeps your mind racing at night, you might need a little help shutting it off. That's where Do Not Disturb comes into play, my doctor-formulated sleep support supplement. Check it out at lifehappens.com or on Amazon.
He had another head growing right on top of his own, one that could blink and smile independently.
Wow.
And this head was actually his twin that didn't fully separate in the womb.
Which is actually called a parasitic twin.
It would cry when he laughed and stare blankly when he slept. Now, each head was actually functioning off of their own separate brains.
So it depends on the attachments, depends on how this formed. It's not always like two separate brains or separate organs. Sometimes they can be sharing.
3, 2.
Oh, man.
Hey!
Holy cow.
What happened to him?
That is a 16-pound bowling ball going at a ridiculous speed, probably upwards of over 200 miles an hour. Just destroyed the body. Straight through it, blunt trauma, penetrating trauma, all the trauma. Like, this is awful. Oh, it was shot out of a cannon to be able to get that speed. Wow.
Yeah, the cannon!
Usually they're not perfectly round, the objects getting shot out of a cannon. Maybe a bowling ball is, but before that they were using just like big, massive balls. They might be misshapen a little bit, so they'll actually start spinning. It's actually the rotational force that might actually do some ripping.
Let's watch the bones just give up. Crack, 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 crack. Good. That's a lot of grief. I was questioning myself if my guess was going to be right, if it would actually go through, because...
So really cool here, the slow-mo shot. You can see the ribs cracking. You can actually see them cracking in multiple spots, and this is very common for any sort of rib fracture from even just somebody falling on the ground. If it's just an isolated rib fracture, not a pneumothorax or hemothorax, and not other major issues, there's nothing to do. You can't put a cast on the rib cage.
And like we've seen bullets coming like out and then get pulled back in. And the bowling ball has so much surface area, but it still made it through. Yeah. Even with that spine and that metal rod in the way, it's still just plowed right through.
Here in the slow-mo, we can see it's not as spinning as much. It's just blunt trauma going through. You're ripping through the heart. Your pancreas is now gone. Your stomach is going to be ruptured. You're hitting part of your liver. You might be hitting some of the spleen.
Oh my gosh, his spine is outside of his body.
Completely blew his spine out.
That's about the diameter of a bowling ball, isn't it? That.
Wow, just destroyed all the bones of the back. The spinal cord is totally destroyed. If that were to occur and you missed everything else and you're survived, likelihood paralyzed from that level down. There's no way to repair a spinal cord once it's significantly damaged, unfortunately.
Split apart, man. Oh my God. Look at that.
More real-life practical applications of these type of injuries would be massive car accidents. Significant amount of blunt force. Things don't necessarily go through you, but different objects could in getting thrown from a vehicle.
The important question is, Chris, do you think he survived?
I mean, he's gonna need some serious attention.
The likelihood of survival of this injury is none. There's always a very slim chance that somebody could survive, but getting hit in the xiphoid area, pretty much where your heart is, it's going to take a lot of that energy, and it's a muscle as well, and it can just get destroyed open.
All right, so we have a concrete pit where we can safely detonate small explosives. We've got a hand/arm sent out by Ballistic Dummy Lab.
Wow.
So we have an MK2 fragmentation grenade.
Fragmentation grenade, I believe, correct me if I'm wrong, is designed not just from an explosive standpoint, but to have fragments, like pieces, shrapnel, to cause penetrating trauma and injuries.
Fire on the hole! 3, 2.
Okay, there's not gonna be an arm left. Grenade causing an amputation off of your hand. What would you do? What's the scenario? How would you help this individual? Well, first, probably at the same time, multiple things are going to happen. You need to worry about blood loss on the extremity, but you're not gonna lose that much blood that fast on the arteries that distal. Oh my gosh, it's gone. Just flying off.
Oh, there.
There. Goodbye. Hand's not even there anymore. You also need to make sure they have an airway, make sure that they're breathing, and make sure that they're alive and they have a pulse. Again, all these things are happening kind of at the exact same time. You want to probably get a tourniquet on this. Yep. Whoa, cool camera angles.
It's a lamp.
It turns the arm into a fiber optic.
So imagine if you didn't throw the grenade.
You also deal with all that debris hitting you as well. So it'll be actually a lot more trauma and damage than what's actually depicted here.
That's
what's left.
What you get.
Oh, that's actually a really useful visual.
Exposure to the bone. Be careful. That bone can be very sharp. Most likely going to happen, it's going to be shaved down further and covered with tissue. Clean it up, antibiotics. You're probably going to be in a hospital for not just days, probably weeks.
Our German Pak 40, it is actually the last Pak 40 that still fires in the world.
Oh.
And right now, that's pretty cool. We are about to make that ballistic dummy mincemeat.
Mincemeat.
Holy cow. Okay. I think this is like an anti-tank weapon. I don't think the ballistic gel has any chance.
Watch your boy about to get started.
Oh, it just melts away. Wow.
The head did go up.
That's a big hole.
It's almost like a large version of a bullet that we're seeing. But then the hydrostatic pressure causes so much destruction to the tissues, the bones, the blood vessels, the organs, that there's literally nothing left. They're all gone. We do not see stuff like this at the hospital. The only time we really see explosion of tissue and injuries is when somebody falls, the tissue explodes open due to the pressure that it has. When we see people who get GSWs, you have some of this to an extent, but not a lot.
It just turned him into a jelly-filled donut.
It jumps up and flips around.
Yeah.
Oh, he on X Games mode.
Hydrostatic shock, the shock wave, almost like when you throw a rock in the water, it makes the initial bloop, and then it's got all these other ripples around. Same thing here, it's got the initial projectile through, but then it has reverberation all the way out, causing massive destruction and explosion. Oh, what is this?
Holy cow.
Oh. Holy cow.
What the heck? Look at the pieces. Vortex of
what is gel?
Is that just a goo hole?
Many, many reasons here you want to protect your brain. For less fatal focus issues, Level Up by my company gives your brain a real tactical advantage. Made for energy and focus without the crash of energy drinks and other products. Find it at lifehappens.com or on Amazon.
That's the wad behind it, follows behind it.
They said to stop headbutting footballs.
Wow.
It flashed again on the inside. It flashed on the back of the skull.
You're seeing the skull fragment into a lot of pieces. If the brain was there, the brain would be just gone at this point. The gel is actually holding onto the pieces a little bit, so from that component, it's probably not as real. Those pieces would be shattered everywhere, all different sizes, on the ground. These all kind of like stuck together.
Like, what is going on there?
Looks like you got a trumpet on your hand.
So it had so much energy that by this point, it was still going fast enough to just vaporize air.
When I've seen somebody get hit in the head with a golf ball, it hits, but it also spins on the tissue. It actually causes a laceration, almost an avulsion of tissue. It can cause skull fractures, intracranial bleeding.
Okay, this is the swipe test with no abrasive. 60,000 PSIs of water.
60,000 PSI of water. That's going to cause a massive amount of damage. Yep. Sliced right through it. Like a knife. The reason why they actually use this device is it can cut like metals and things like that. People would come to the emergency department from these type of industries. They would have avulsions, lacerations, amputations, full-on missing hands. That's why when we like prescribe prescription and it says, please don't operate heavy machinery, this is kind of the reason why. depending on how good of an injury this is, I mean, like how clean it is, it's kind of a crapshoot of, will this be able to be replanted or not? Are you able to reattach it? First off, always bring it with you. If they're hanging on by a thread, just wrap it up there because maybe that thread is a blood vessel and still giving it good blood supply. Really interesting are pupils. They dilate or they constrict. So meiosis versus mydriasis. This is regulating the light that goes in and out of our eyes. So if it's really bright out, we're gonna constrict down. And if it's really dark, we're gonna dilate up. It's like some rough, heavy metal. I feel like I'm gonna have a seizure. When your autonomic nervous system kicks in, your fight or flight, you're gonna dilate up. You're gonna run away from the bear and you need to run and see everything and take in all the information. Oi! Multiple different injuries to the head with the red stuff. This is actually quite common in the emergency department. People fall is probably the most common reason why you have head injury. The biggest thing we also worry about is cervical spine injury. A lot of times people who do have these falls will put in a seat collar, they'll get evaluated, and then we will check first a nexus criteria, which is criteria for examining the neck. Look at that neck! We need to get a CT scan of the neck. The blade comes out and the door shuts. I think that's a smart move. Having some hyperventilation, breathing really fast, what ends up happening is you're actually blowing off a lot of CO2. If you blow off too much, you're gonna get carpal spasming. We actually try to get them to breathe into a bag because we want them to keep some of the CO2. Midline thoracic injury, hard to do. You have your sternum in the way as well as a rib cage, but you can go in between. I've seen that before where somebody slips a knife in between. Mr. In between. You worry about puncturing the heart, either the atriums or the ventricles or even the aorta. Seriously detrimental things that you have to worry about. If there is a hole in the heart, you don't know it truly until somebody significantly has bad vital signs, really poor clinical presentation. We have a cervical neck fracture. Osteopathic physicians as well as chiropractors do a technique relating to the cervical spine manipulation. The idea is to put your body back in balance. Oi! GSW, gunshot wounds, single bullets to somebody's cranium, aka head, yes, can cause detrimental effects. And sometimes it might skim off, sometimes it might cause some bleeding, but survivable. Depends on caliber, distance, and what area of the brain is actually hit. Small hole in, bigger hole out. Oh, geez. Oh, wait a minute. Hole straight through. So I don't ever see that. Facial lacerations, but without hitting the eyes. Likely you're gonna hit the eyes and you're gonna have an open globe laceration. The biggest thing with those injuries is not to touch it. Don't touch it! Because of the fluid, you wanna make sure that you just close your eye and maybe have a protective cup over top of it. Massive facial injury. You can have a lot of facial injuries and still be kicking. It just has to do with the amount of blood loss that you're having, so you can't perfuse your organs, and then thereafter, okay, how do we repair this? Massive injury to the lateral aspect of the neck. I always discuss neck basically between your collarbone up to your jawbone. Highly vulnerable area of injuries. Your major blood vessels, they're there on both sides. You can bleed out pretty well. Interesting. This character ends up wiggling and dancing on the floor. Is somebody passed out? Are they in pain? Or are they actually having a seizure? Typically, seizures are rhythmic versus we see people who shake and move in all different directions. Sometimes this is a psychogenic seizure versus a hypoxic event. If somebody's actually truly having a seizure, roll them on their side, pad their head. Don't try to stop the shaking. Do not put your fingers in their mouth, nothing like that. Typically, seizures will stop after a minute or two. Oh, trying to help. We can actually tell when somebody's in a lot of trouble just at the way that somebody is breathing. Shane Stokes versus Kuzmal. Sometimes we see agonal breathing. Those we do not like. We need to intervene because soon that's going to stop, and then with no oxygen, you're going to go into cardiac arrest.
Cardiac arrest.
Massive traumatic injury to the brain. You can have bruising of the brain sloshing back and forth without skull fractures or rupture of blood vessels. You can have subdural, epidural, or a subarachnoid type hemorrhaging. Uh-oh. Oh my gosh. I've actually witnessed people who actually bite other human beings and have to come to the emergency department. People are not for biting. Please don't do that. Could you live without half of your brain? Could happen. I do see people come in who've had massive injuries where half their brain is gone and they're still around. Now they're not 100% themselves anymore. Oh, projectiles. You have a rebarb, say, through you. If it's not so big and long, I do not recommend pulling it out at this point. My classic line, please do not pull this out. Whatever it's damaging, it's still holding it together. This is either through the lung, this could be through your liver, this could be through any intestines or your stomach. Uh-oh, that's never good. Uh-huh. For some people, watching or playing something as intense as Sprunki might make their heart race. That's where chillax comes into play, to help find calm vibes when life throws unexpected chaos your way. If you want to learn more, check out chillax at lifehappens.com or find it on Amazon. Do matrix duck. Oh. I've seen circular saws take fingers off. I've seen big machines that do crushing where people get stuck and they end up losing hands. If anything happens like that, control the bleeding, bring pieces, if they're not on you, quickly to the hospital. They're not happy here. Get in there. Oh, it's like a whole family. Interesting.
Interesting.
We got a lot of bandages. We got some people on the ground, the young ones. Pediatric patients, when they actually come to the hospital, the whole place gets really nervous, especially when it's not a pediatric hospital. We always want to make sure that the patient's doing okay. Every single ER doctor is trained in pediatric and adult medicine. There are doctors that are specifically trained just from pediatric emergency medicine. Oh, so classic of Dexter. It almost looks like a 10 or a 15 blade that he's using. Basically a scalpel, but there's different shapes to them. That type of cut in general, it's super sharp, so it's really easy to close up. It will probably heal really close, like a paper cut, so to speak. Dexter here has his own kind of PPE. We use similar things. The face shield is quite similar. We have a mask with a shield. We don't use the aprons, but we use sterile gowns. Oh, hammer. Pick up the hammer. We do get hammer injuries, traumas from people hitting their hands. But we've also, unfortunately, seen where people use hammers as objects to hurt each other. I've definitely seen some head injuries related to it. The back part of the hammer, a little bit more sharp, so to speak. If it's into the brain, depending on the frontal lobe versus deeper and multiple strikes, we'll see people who come in with hematomas, contusions, or intracranial bleeding, a subarachnoid, a subdural, or just destroyed brain tissue. And if there's likely destroyed brain tissue, there's really not much for us to do.
Hello?
Dexter, I need you to go to an all-night pharmacy right away.
I'm kind of in the middle of something.
Sometimes I will answer the phone when I'm in the middle of a procedure at work. I don't know the number, but I need to answer it. All my work calls go through our cell phone as well. If they just don't have my cell phone number, they have a different work number that gets transmitted into my cell phone.
Oh, Harrison has an ear infection. He's in a lot of pain, Dexter.
Right, my mistake. I wasn't thinking. I'm on my way.
Harrison has ear infection, his son. Ear infections stink. They are very painful. It's swollen tissue that's supposed to move when you hear. It also has to do with a lot of inflammation just in and of itself, and it's very innervated there, so you feel it a ton.
The good of the family.
Oh, it looks like he's going closer to the left side of the heart. You're going to leak a lot of blood out into the mediastinal cavity, and then eventually you're going to bleed enough to where it's not pumping out blood to the rest of your body, or it's going to compress down and not be efficient anymore.
Well, I'm real sorry for you, boss, but your dead wife can suck my.
Oh, that's not good. Oh, that's a bad device. Oh, I'd see people headbutt each other. I don't know if it's like the smartest thing in the world to do. Everybody says the bone in your forehead is super thick. Yes, it potentially is. But remember, you have your frontal sinuses here, which actually is thin bone because it's got air in between it. Dexter getting splashed with the red stuff all over his face. Now you have body fluid exposure. We're worried mostly about bloodborne pathogens like HIV, hepatitis B and C.
No, I'm here to kill you with that pen.
Whoa. Ah, hard to tell if it's an injury to his left shoulder or left chest, but more likely it's going to go into the soft tissue. Potentially, if it's more anterior chest wall, there's always a risk of trying to go into the lung. You'd have to have a lot more force to be able to get there. Oh, he's going directly into the major vessels of the left side of the neck. Carotid artery and your jugular vein, you have it on both sides. You have the sternocleidomastoid that sits over top, and underneath that is where those big vessels run. Yeah. So actually they're doing a pretty good depiction of it. Very dark blood, so this is probably venous blood. This is most likely the jugular vein just bleeding out. What he's experiencing, potentially getting lightheaded, dizzy, but would you pass out? Would you succumb to the injury super fast? Probably not. You have 10 to 12 pints of blood. For you to potentially pass out, you need to probably lose about 25 to 30% of your blood volume.
Friends forgive, but I don't forgive you.
Oh.
I don't get to have friends.
Oh, usually he uses a blade. Interesting.
You're a little freak.
Strangulation type injury, which we do see often in the emergency department and do have to rule out any major injuries. You can see petechiae or bruising to the neck, and we will do a CTA of the neck.
You think I'm done with you? You think this ends here? It doesn't!
When we want to look at the airway and make sure that there's no damage, make sure there's no fracture of any cartilage, and we're making sure the hyoid bone looks fine, looking to make sure the spinal cord looks fine, and the bones around the cervical spine. We're also looking at the major blood vessels, hence the A part of the CTA.
It does for you.
Wow. Getting both their major vessels compressed down as well as the airway being compressed down. So those are two ways that somebody can potentially pass out. So you're not getting blood flow going into the brain via the arteries or blood flow out, and the decrease of oxygenated blood in will cause you to pass out. Oh. Did he snap his neck? You can have a high cervical fracture from twisting really hard on somebody's C-spine, but it's got to be high so it's closer to your brainstem. So it stops all that information going to innervate your body to breathe and have your heartbeat. So the diaphragm's going to stop. Your autonomic nervous system is going to be interfered with. Oh, Miami Airport. Oh my gosh, how often do you get mad when you see a closed bathroom and you need to go? The closer you get to the bathroom, the more you feel like you gotta go, and that has to do with your body's like nerve impulses that you're about to cause a relaxation of your sphincters so that way you can decompress your bladder and let things out.
Excuse me, sir, I have your wheelchair.
I don't need a wheelchair.
Oh, the classic Dexter injection of medication. If you're looking for a legal, non-prescription way to knock out at nighttime, you should try Do Not Disturb by my company Life Happens to help you drift off to sleep naturally, no needles, and no neck trauma required. Find it at lifehappens.com or on Amazon. We don't like when people are in that position where their heads are down like this because they can occlude their own airway. That's why when you do like CPR and you're doing rescue breaths, you either do a head tilt chin lift technique or you do a jaw thrust because you want the airway to be open, or the jaw thrust when you actually grab the angle of the mandible and pull forward. I've had many cases over the years where people have difficulty breathing and you put them on a BiPAP machine, which is that mask like a CPAP. They're so weak and tired that they're start occluding their airway and they're going to start retaining CO2, becoming more altered, so you actually need to intubate them.
It never matters your destination. The smart traveler must be prepared to make last-minute adjustments.
The wheelchair did not have the wheels locked. You want to be really careful when you're transporting people and trying to put them in a wheelchair, because it can go out from under them and they land and hit their buttocks, hit their tailbone, or go all the way backward and crack their skull open. Oh, gnarly. Pretty good depiction. Even with the seatbelt, you get jostled around, and that's why patients come in. They still feel like sore neck, body aches, because as you get thrown around in a car accident, your body's doing everything it can to protect yourself from flying around.
One moment.
It's so funny. This stethoscope is like a chintzy, not very good stethoscope. It's almost like the ones we use to throw out if a patient harboring some sort of bad pathogen. It's not very good. You can't really hear much with this.
Is there a problem?
No, it's perfect. You're a good candidate.
Very intricately feeling the spinous processes of the spine here. Don't know if they're feeling just from an anatomy standpoint, they're feeling for area to inject, but this is the thoracic area. I don't know what this is. The activator almost looks like the normal scissors that we have in like a suture kit. Having an injection could be placing an IV versus just injecting into a vessel. We're seeing this yellow fluid. The only real yellow stuff that we see in the emergency department that we inject into people is TPN, which is basically total parental nutrition, which is basically like a banana bag, but it has vitamins in it. That's why it has that color. Using a tourniquet, so we use a tourniquet in the hospital to plump up the veins, so you kind of keep the blood in that area. So you do it on the bicep to keep the venous blood in, so it dilates them up a little bit, so it's easier to access, and then you actually release it once you access the area. Oh, that's not good. The fall to the ground right on the jaw, on the tile floor, can fracture a jaw, break your teeth, lose your teeth, cause intracranial bleeding. Just a fall from that height without protecting yourself can cause significant trauma. When somebody comes to the emergency department, we're gonna get a CT scan of their head, neck, and face. Whoa, what is happening here in the back? If you saw a back doing that, that's muscle fasciculation, that's muscle movements. Sometimes we'll see fasciculations after we give medications for RSI, so rapid sequence intubation. You're giving a sedative, but you're also giving paralytic, so different things happen to the muscles. Eye changer, what the heck? No way, never seen this. That's crazy. Your pupil doesn't split off like that. Come on. Come on! You only have one pupil, your eye couldn't do this. You could have injuries around the iris and the pupil itself, which could not have the pupil perfectly round. It shows that you maybe have had like previous surgery, but you wouldn't have two. It would all be connected. Oh, wasn't expecting that to happen. What? This actually happens post-surgical things. When somebody has a wound that opens up, we call it wound dehiscence. The wound edges will look like this. They're not actually bleeding. The edges of the skin and the subcutaneous tissue did not take to each other. The wound will heal from the inside out. You just have to keep the edges clean, the wound clean. You can't just go back and resuture it shut. What the? Is it like another version of her? Oh, people vomit a lot and come to the emergency department for vomit, and they tell me it's green or yellow. When you do have that type of vomitus, in general, that is your bile. What's stored in your gallbladder, it's very bitter. People get really grossed out by it. Not dangerous, nothing to worry about. It just means you vomited a lot. Oh, sewing back together. Sewing back together, as I just discussed, the likelihood of a wound that dehisces like this won't go back together. And then we're using a big suture here, probably like a 0. And the material itself, you can see it's like fraying. It almost looks like rope versus like a nylon. You don't want something this massive because it's going to leave massive holes and scars where you leave the suture material. In areas where your skin is thicker, like the back here, and there's more potential tension on it, you might need a thicker material, but you don't necessarily need this massive and large. Food tray. Are they doing this? The IV sideways? All the nurses out there or people put IV lines in, you know you don't put it that way in. And of course, not to mention it's not sterile, no gloves, and the skin wasn't prepped. Whoa. Whoa. Anybody have that like high-pitched noise that just doesn't go away? That's tinnitus. Sometimes you get it, it comes for a couple seconds and then goes away, but some people get it all the time. Try not to get any ear damage from listening to too loud of music out there. Holy shnikes, that is a big needle. It's got markers on it. It has an introducer to it. You can see that there's the small green cap versus the big massive cap that looks like a Lego. That piece comes out typically because that's an introducer to allow the catheter to stay. Okay. Nice. Needles that I've seen that big that we use in the emergency department are spinal needles. We'll use a needle about that long, typically 3 inches for spinal taps or a lumbar puncture, but our job is to actually use the smallest gauge needle that we can use to access the area. Oh my gosh, that's a lot of CSF. I'm assuming they're pulling out CSF. CSF, cerebral spinal fluid. Usually you're just taking a couple mLs, not taking out 10 mLs. Oh, what the heck? It's a BBL gone wrong. What is that? What? So you normally can't stick your fingers in your belly button and get going onto the inside. Yes, there's not that much material from your belly button to the inside. That's where our umbilical cord used to be to give us nutrients into our bodies. But no, you can't do this.
Freak is this?
That literally looks like an uncooked chicken leg. That's gross. Oh, it really does look like a cooked piece of chicken. What is this? Bleh, what was that? What is this? Your belly button doesn't look like that. It looks more like your butthole. No, we've got it wrong. Oh, doing CPR.
Lovable part of me, you have to come back. You have to come back. Come back.
Okay, not the best CPR, but you can do CPR while on a patient like that. There are times in the hospital where somebody might be transported on a gurney that instead of doing it on the side, a hospital staff member will actually jump on top of the bed and actually do CPR in this position.
Come on. Come on.
Oh. Wow, gross. Trying to get blood into the body here. You can do this. I've never seen it done before. And again, you got to be careful because of the tubing. You have air within the tubing that you're potentially getting into the body. Oh. Falling on the ground like this would increase the likelihood of a skull fracture and intracranial bleeding, especially in somebody who's quite frail. You'd think somebody who's frail like this, typically the brain would end up shrinking a little bit, which then increases the risk of the brain jostling around within the skull itself. You can see the classic spidering pattern of a skull hitting glass. So you see this in this type of injury, but you see it a lot with car accidents as well. We always ask EMS to tell us if they've seen something like that when it comes to a car accident. Cool dress. Uh-oh, falling apart, tooth coming out. Another tooth. Don't. Oh gosh, that's why I'm not a dentist. Not a dentist. Pulling your own tooth out. Yeah, not cool.
It's not cool.
What you would end up doing is shoving this right back into the socket and splinting it in place. So you're gonna splint it with your other teeth. Boy. Don't just pull them out, put those back in. Sometimes the teeth can fall out due to trauma. You can have gums that are receding. Also, if the bone is destroyed where the tooth is attached, or if you're having chronic changes to the bacterial environment of your mouth, increases the risk of potential tooth decay. Oh, the nail. Oh, don't pull the nail. So, okay, people will injure their nails sometimes. That is totally normal. Stuff happens. Don't pull the nail out. The nail itself is the best splint that we have. If you don't, then we have to use some synthetic material, literally like a piece of foil. Oh my gosh. Is she being reborn? Oh, we got the yellow vomit. What the heck? It is a real-life teratoma. A teratoma is a type of tumor that has all undifferentiated type tissue in it, which typically is like hair and teeth and nails. This looks like a placenta, but the vasculature is huge. It doesn't normally look like this. The placenta itself, lots of different blood vessels, kind of all over the place, something like mashed up together, but it's really important for the development of a baby. Whoa, freaky. I don't know what's in that injection, but I do know the best anti-aging serum isn't some sci-fi substance like this. One of the best things that you can do for your body is sleep. That's why I formulated Do Not Disturb from Life Happens. To help you fall asleep fast, check it out at lifehappens.com or on Amazon. Yeah, no joke. What would you do if you ever saw that in real life?
That's gonna kill me. That's real.
I don't think you just scream and call out people like that. Help them. Get them help. A lot of fluid that's getting sprayed around in everybody, increasing the risk of bloodborne pathogens, HIV, hepatitis. I don't know what that's supposed to mean.